everyone. Welcome to Orion Beaumont Health Series. My name is Maria Letwak. I'm the nurse practitioner and stroke coordinator for Troy Beaumont Hospital. And this is Courtney Witczak, Doctor of Physical Therapy and our senior physical therapist for Troy Beaumont Hospital and our stroke program. Today we want to welcome you to talk about stroke awareness, since May is our Stroke Awareness Month. We'll begin by speaking about what a stroke is. First of all, a stroke occurs when the arteries in the brain are blocked and the blood flow cannot go through. So the brain cells themselves start to die. You may also have heard about something called a transient ischemic attack. That's also called a TIA, which you might be more familiar with. This occurs when the blood supply to the brain is blocked just for a short period of time. So you or your loved one might just have symptoms for a few hours or even less than a day. But we still consider that a mini stroke or a TIA. As you see from your screen, there are a couple of different types of strokes. The first type of stroke we're going to talk about is an ischemic stroke. And that type of stroke occurs when a blood clot blocks the blood flow to an area of the brain. As you can see from the picture, the area of the brain dies off in the gray period or the gray section because no blood is going through to that section of the brain. The other type of stroke is called a hemorrhagic stroke, and that's on the right-hand side picture. In this case, in a hemorrhagic stroke, bleeding occurs inside or outside and around the brain tissue itself. So let's talk about the most important things. How can we prevent a stroke? Well, here's what you can do. You can control your personal stroke risk factors, and as you can see from your screen, there are several of them. First one is called high blood pressure or hypertension. You can control high cholesterol, a heart condition called AFib or atrial fibrillation, carotid artery disease, which is blockage of the arteries here in your neck. We have two. Obesity, diabetes, heart disease, smoking, and alcohol, narcotic, or substance abuse. All of those risk factors can be controlled. We also advise you to prevent strokes is to take your medications exactly as your doctor has prescribed. What I counsel my patients on is this. If they have prescribed a medication for you to control your high blood pressure or your high cholesterol, but you don't feel it agrees with you, please do not stop that medication. Please do not take it the way that you feel you should take it. Take it the way the doctor has prescribed and call the doctor's office and ask for an appointment to be reevaluated for your medications, because perhaps they can prescribe something else for you that you can tolerate. We also recommend that you keep your regular doctor follow-up visits, especially if you have any of these risk factors for stroke. It's during those follow-up visits that your doctor or healthcare practitioner evaluates whether or not those risk factors are under control. But at the very least, we really want you to have at least an annual physical exam. Your doctor may also order some diagnostic testing related to these risk factors, and we really won't go into detail about that. We'll talk about some diagnostic testing in just a little bit. As you can see from your screen, we've presented to you a risk scorecard for stroke prevention. And we want you to take this risk scorecard and take each line and check off a box that applies to you. As you can see, the columns are divided into red, yellow, and green. We want everybody to be in the green zone. But sometimes when you find that you have a lot of check boxes in the yellow zone, you may be at high risk for strokes. But most definitely, if you have a lot of check boxes in the red column, you're very high risk for stroke. And if you haven't seen a physician or a healthcare practitioner, I advise you to do so as soon as possible. Let's talk about what do you do in real life. We're going to teach you something that's fun and very easy to do. and it's something called Act Fast. Once you learn how to do that, you're going to be able to recognize likely the symptoms of a stroke in any person that you encounter. More importantly, if you have someone or you're with someone or you yourself are having these symptoms of stroke, I want you to call 911 immediately to get you to the closest primary stroke center for emergency stroke care as fast as possible. I don't want you to drive yourself or have your family member drive you to the emergency room, because the most important thing I want you to remember is this: fast treatment leads to better results. So let's go ahead and we're going to demonstrate for you how Act Fast as a recognition for stroke symptoms works. So Courtney's going to be my patient, and I'm going to ask her, the first letter of FAST is F. Ask your friend to smile, and you want to look for an equal smile on her face. Her face is beautiful. She's got a perfect smile. Both sides are equal. The letter A is arms. Ask your friend to extend their arms with their eyes closed. And if you see their arm drifting down on one side or even both sides, this could be a sign of a stroke. And finally, our S is for speech. Ask your friend to say a common speech. Have a nice day.
Have a nice day.
If they say that nice and clearly, that patient's doing fine or your friend is doing fine. But if they find that they can't find the words to repeat what you're saying and you feel that something is unusual for them because you know them very well, that is also a sign of a stroke. And the last letter is T. That's for time. And that means I want you to get 911 help immediately. So just in summary, what I want to say to you is this: if any of those symptoms of the FAST picture that you see on the screen right now, if any one of those is positive or you have a problem, I want you to call 911 right away. When I spoke to you about calling 911, I want you to know that in Oakland, Macomb, and Wayne counties, we have specifically worked very closely at Beaumont to teach them specific stroke treatment protocols. And they have been directed by the governing bodies in the state of Michigan to transfer the patients as much as possible to a primary stroke center. Troy Beaumont Hospital is a primary stroke center and received this designation greater than 2 years ago. Our other two hospitals, Royal Oak and Grosse Pointe, are also primary stroke centers. However, I do want to distinguish Royal Oak Hospital. Royal Oak Hospital has been distinguished as a comprehensive stroke center. There are only one other hospital in the state of Michigan with that designation, and likely less than 50 in the whole United States. So you can feel confident you're going to get great treatment for stroke there. Stroke treatment itself, let's talk about if stroke happens. What tests are available? What we do is a CAT scan of your brain, and the purpose of that is to make sure that there is no bleeding in the brain. The other two medications that are listed on the screen that you see there are thrombolytics and TPA, and quite frankly, those are one and the same thing. And just the easiest way to explain it to you is this. Thrombolytics, or TPA, is a medication that's a clot buster. And we talked before about what causes a stroke, and that's a clot in the blood vessel of your brain. So that medication can break up that clot in your brain. Let's talk just very quickly about the services available to you at Beaumont Health System. And these are tests that will really help you prevent a stroke or identify whether or not you're at high risk. On your screen, you'll see several tests. And the first test I'll talk about is called 7 Test for $70. They'll test several different things related to heart disease and stroke: blood pressure, body mass index, blood cholesterol, hemoglobin A1C, an EKG, stroke screening with carotid artery ultrasound, abdominal aortic aneurysm ultrasound, and peripheral artery disease screening. Those are all great tests to screen for heart disease and stroke risk factors for $70. The other programs that we have are smoking cessation, outpatient diabetes clinic, Beaumont's Weight Control Center, and they have a free seminar that you can attend and find out about their programs. Just call and register. And finally, our atrial fibrillation clinic. From your screen there, you can see if you have any other questions, we have a 1-800 number that you can call. Now I'm going to turn it over to Courtney, who's our specialist, our doctor in physical therapy, and our senior physical therapist in charge of our stroke program.
Thank you, Maria. So, rehabilitation after stroke. What to expect at the hospital, what to expect after yourself or your family member have suffered a stroke. Our goals for rehab, as you can see, is to not to cure the patient from this stroke. The medical team we work very closely with will help attain the best quality of life after you have suffered a stroke. This is very important to get a long-term quality of life outcome. So some things that can happen, as you can see listed on the screen, after stroke: impaired motor control. This is inability to do something, inability to, you're very uncoordinated with your strength, or when you're walking, if you can't feel things, sensory, if you can't feel light touch, if your family can't feel something on one side of their body, or if you're having differential between hot and cold. Balance, if you're sitting or standing, if you can't maintain an upright sitting posture, if you're slouching to one side, that's also a symptom of stroke. If you're having visual changes, if you're seeing double vision, or if you're seeing half of your vision is cut, that's another option or a symptom that can happen. The main thing too is not just physical, but it's also emotional and cognitive. Sometimes people have a problem distinguishing how to do something or how to count, or they can't remember someone's name. As Maria talked about before, the aphasia is sometimes they can't decide, and they're receiving the information and it's all jumbled, or they can't tell you the right word. They're reaching for you to say, call someone or call for help, and they're saying, grab my shoe. So these are all things that you should be aware of, and it's normal, and it can be rehabilitated after the medical team has done their workup. So what should you expect if you come in with a stroke and you're diagnosed in the hospital? And one of the main things is you'll see physical therapy and occupational therapy at Beaumont within 24 hours of admittance into the hospital. We work very closely with the stroke team, the stroke neurologists, Maria for being the stroke coordinator. We have a very good protocol at Troy where we are able to initiate our own orders based on physician approval through a protocol signed by our medical director of neurology. And also recently we're able to see patients within bed rest doing basic neuro exams in the ICUs to help prevent contractures, which is inability of your body to stay in one place, and to help increase that rehabilitation stay and hopefully decrease the length of stay you're in the hospital. The main part of this rehab is my family has suffered a stroke. Why, what are you doing? Why are you here right now? It's a very emotional time. Well, this is important for neuroplasticity. As Maria talked about, the area of the brain that's affected after a stroke, you have different areas of damaged tissue. If you don't use those tissues and you don't use that recovery, you lose it. So we want to make sure we have early intervention to help you prevent long-term deficits. There's a few types of rehab. So our job as acute care therapists in the hospital is to say, where do you need to go to rehab from now? We have several areas of rehab. You can look at it on the screen. So first off is acute rehab, or they also call it inpatient rehab. The patient must tolerate 3 hours of therapy a day. They'll get physical therapy, occupational therapy, and speech therapy. They must have goals in either 2 of the 3 disciplines, meaning they must have items that they need to achieve to get back to what they were previously level of function. And then they also are reasonable discharges, home with family, or 24/7 assist. If for some reason that patient can't tolerate a longer rehab, there are subacute facilities or subacute nursing facilities. This is a more or less aggressive therapy. It's 1 to 2 hours of therapy per day. It's available at an extended length of stay, sometimes up to 120 days, which might be better for the family's preference or the patient preference or tolerance. the patient is doing very well, they can go to a home therapy and have home physical therapy or occupational therapy speech come into the house. This also goes along with home nursing. It's likely 2 to 3 days per week, up to 1 hour per discipline, and they work on functional activities within the patient's home environment. This also can be done as a safety evaluation for the patient and the family, which helps out long term. If the patient's doing very well, they can go to our outpatient facilities. We likely recommend outpatient PT, OT, or speech at one of the designated facilities that focus on stroke rehabilitation and have a neuro basis. It's likely 3 to 5 days per week, multiple disciplines available. These are for patients who are higher level of function or have, usually after stroke, you're not allowed to drive for a period of time, so you'll have to have a family member to transport that patient to and from therapies. Advanced interventions are available due to just the increased amount of equipment and the options that we have at that facility. Likely to know insurances, sometimes with changing Medicare rights and different insurance policies, there likely is a copay that goes along with this outpatient. I just wanted to share a few pictures of the Troy. Beaumont has a new inpatient rehab facility. We're expanding beds in July, and this is a state-of-the-art facility, so we wanted to share that with you. Each is now a 12-bed unit, doubling in size in July of 2014. This is, as you can see in the picture, of the patient rooms. All our private rooms have handicap accessible bathrooms, barrier-free. There's a picture of the bathroom. It's all barrier-free. They do a lot of training with the family as well as the patient within these facilities. This is a picture of one of the inpatient rehab gyms. And again, this is a red cord system that also is an outpatient. They do have a functional car with navigation, although you can't drive it. It helps getting the patient in and out of the car, family training. Also is the cognitive deficits of what to do and what you would do first. Put a seatbelt on, put your brake on. This helps get patients back right into that real life instances right after stroke. They do occupational therapists work on activities of daily living, or ADLs. This is a picture of the kitchen. Teaches you what to do and problem solve within your own home. Also how to make items or use these appliances that, because of the stroke, you may not remember how to do. So it's very important to practice everything. Coming in and out of a bed is very important because hospital beds are completely different than the beds you have at home. So they simulate in-home mattress training, in-home transfer to a recliner, and bathroom training within a shower, walk-in shower versus a tub. The other part of our goal is to teach the family and caregivers. So if your family member comes into and has a stroke, the biggest thing is you need to be that support system for them. They're relying on you, and also our medical professionals are also relying on you for information. Best thing is tell us what the patient likes. Do they like sports? Do they like favorite television stores? Are they, do they not like something? Are they not morning persons and they prefer our rehab to come in the afternoon? This is all going to promote better recovery for your family member and as well for you. We want to, sometimes patients neglect one side because of their stroke. Depending on the artery that's affected, sometimes they cannot, neglect the whole right side or the whole left side. This time the patient's neglecting, say, their left side, and I don't see Maria over here on my left. We want to help promote, and coming in early helps promote using those affected sides in activities, eating, self-care, applying lotion, tactile touch, voice. These are all things that, because medical professionals are only in there for a short period of time, you as a family member are with that patient likely 24/7 hours, during the day, or more than we are. So it's good to carry on those rehab processes. Other things we teach you is positioning. The patient's paralyzed on one side, we'll teach you positioning, we'll teach you nursing, but the best thing is to help get that patient promote further injuries. If the patient's paralyzed and their arm's down and positioned behind them, that's for further injury to rotator cuff or having that arm come out of the socket. So we want to promote safety within that hospital stay. And also we want to stress the education that early education is important to everyone. Your family's going to need education as well as the patient. So it's very important. If you have questions, please ask. We're here to help you. We're here to kind of be your leeway, kind of be your voice to in your questions, and we can help kind of facilitate better quality of care for your patient. I just wanted to touch on, there's a very good stroke survivorship group, and as you can see on the screen, it's called Keen Enable. It's based out of Troy. It's a Beaumont support group for stroke survivors and family members. It's one of the oldest support groups in Michigan. You can see the number, you can contact Carol if you have anybody that, at the bottom phone number, if you have anybody that has suffered a stroke or any family members that may have need more information. This group meets every second and fourth Tuesday of each month across from the Beaumont Hospital Troy in the Medical Center building. They also do fun things like Tigers games or bocce ball, so it's interactive, and then they also have medical professionals come and speak on different topics, let it be neurology or therapy or Maria for stroke education. We try to promote lifelong rehabilitation and lifelong learning because this is a difference in your life. We also, there's exercise after rehab. So say you're done with your rehab process, what can you do now? We want to promote it on the screen, as you can see, safe exercise. So this is from the American Physical Therapy of Neurology and American Physical Therapy of Association. We want to remember, after you're exercising, you want to be within a safe range. You think of your target heart rate. You don't want your heart beating out of your chest. You don't want your blood pressure rising too high. So you want to take your 220 minus your age, and that's your maximal heart rate. This is if you were running a marathon or if you're running on a treadmill. You're going to want to exercise is about 40 to 60% of that number. You want to check with your labs and medications. Make sure your physician or your nurse practitioner, your physician's assistant, they clear you to exercise after rehab just to make sure you're within a safe free range. What we like to tell patients is this Borg scale, which I can see on the next slide. It's a 1 to 10 scale that says, how are you feeling? It's very subjective to the patient's needs and their perception of how they're actually feeling. Within exercise after rehab, we want you to be between that 3 and 4 mark, which is moderate to sort of hard. We don't want you going to the point where you can't get up for the next 3 days. So this is very important to reflect on how you're feeling, see how you're feeling, and if you have any questions, you can always call your therapists. The numbers for the Beaumont therapists are always on the back of your education templates, or call your physician to see if you have any extra questions regarding how much you should be doing. So exercising after therapy, if you can see it, there's a lot of contraindications, things that maybe you should stop and call your physician. If you have a heart rate, if you're just sitting there, if your heart is beating out of your chest and it's over 100 beats per minute or less than 50 beats per minute, you want to be aware of that and maybe not exercise until your physician clears you. If your blood pressure is over 20 or 200 systolic, we want to make sure that's cleared by your physician as well, or under 90 for your diastolic, which is the bottom number when they give you your blood pressure. If you have increased sweating, headache, fever, edema, which is swelling in your arms or legs, if you're a congestive heart failure patient or have that diagnosis, you want to be aware of if it's starting to, if you can push your fingers into your arms or legs, if it's actually staying in there and you can see the imprints of your body, your fingers. If you're short of breath, or if you're having any new numbness, tingling, or weakness, we want to be aware of that. Stop the exercise, call your physician, make sure that you can make an appointment to kind of get those symptoms checked out. So when you are exercising, when to stop exercising? A lot of it is the same symptoms I've already discussed, but if you're having shortness of breath, or if you're having chest pain, if you're incoordinated, or if you're having a severe headache or dizziness, please stop your exercise, rest, kind of self-reflect, see how you're feeling, and then go on based on how those symptoms resolve. We have a very good program at Beaumont. This is for patients who are after outpatient care, or they are done with rehab but still want to exercise under a medical professional's guidance, or for those patients we've done who don't have health insurance or outpatient services or home services are not provided. This is a great option. So Royal Oak and Troy both have 2 neuro exercise groups. The purpose of it is to offer supervised exercise training after discharge from a formal therapy. let it be inpatient or outpatient. It includes cardiotherapy, which is like bikes, walking, upper extremity exercises and lower extremity exercises, so both for your arms and legs, either with weights or without, and stretching. It teaches you how to do the right things appropriately, but also gives you a supervised medical professional so that you can ask questions if needed. They only ask if you do require physical assistance, like if you need someone to help you get up, that your caregiver or aide come to participate as well. Listed on the screen, you can see that to the left, it's Royal Oaks Health Center. It's on Coolidge Highway in Royal Oak, and you can call that number to register. The Beaumont one is and the Rehab Dialysis Center, which is the outpatient center across from the hospital on the other side of DeQuinder. They do limit this class to 6 patients with 2 group facilitators. So it's a very small, it's a competent group of medical professionals that helps you try to exercise in a supervised manner. The cost of the class is $13 per class, and your aide or your caregiver does not have to pay. They're just here to help you. These are a list of our references based on the information we provided you today. The Beaumont Health System Neuroscience Center of Excellence, and there's a hyperlink if you would like to get some of that information. The National Stroke Association that has the Act Fast as well as the risk factor card, and the American Stroke Association. And then a lot of it from the hyperlinks, you can get the exercise information from the American Physical Therapy Association off of the American Stroke Association websites. So thank you for watching today, and we're very pleased to come be invited to talk to you. If you have any questions, our contact information should be listed, and I think the next session will be on lymphedema by one of our supervisor therapists, Janet Seidel, and thank you very much.